This presentation will familiarize you with the EVLT procedure used at Legacy Vein Clinic. VenaCure is the name of the company that developed the laser that is used in this procedure. The VenaCure EVLT system has been used with more than 70,000 procedures over the past 5 years and has become a proven alternative to invasive surgery. EVLT stands for endovenous laser therapy. It's a safe, proven, and FDA-approved method for eliminating unsightly varicose veins. Because it's an outpatient procedure, there is no hospital stay required. It's minimally invasive, so there's minimal or no scarring. There's also no lengthy recovery, and in rare instances where there are side effects, these are easily managed with pain medication to alleviate discomfort. The EVLT system uses targeted laser energy directed at a vein to seal it shut and help patients look and feel better fast. The Legacy Vein Clinic has found EVLT to be a highly effective treatment for varicose veins. We have many before and after photos that show a noticeable improvement in appearance, as well as patient testimonials telling us how they feel better and have less pain and achiness in their legs. It's important that you understand about varicose veins, including what causes them and how they can be treated. First, varicose veins are a very common problem. About half of all adults 40 to 69 have them, but in addition to being unsightly, they can become painful and sometimes even debilitating. That equates to about 20 million people in the United States who are suffering from varicose veins or spider veins, which appear on the surface and give the skin a discolored appearance. Women are twice as likely as males to develop varicose and spider veins, but that means there are still millions of men who suffer from this condition. There are several causes of varicose veins. The condition is passed along to you genetically by your parents. It can be a normal part of the aging process. You experience hormonal changes. These changes can relax the walls within the vein and cause them to bulge. This is one of the reasons why they are so common in women. You have one or more conditions that can put a greater than normal amount of pressure on the leg veins, such as a job that requires prolonged standing, or if you're overweight or pregnant. Varicose veins can also be the result of more serious vein disease, which can reveal itself in blood clots or in other conditions that may have required vascular surgery. Varicose veins are the direct result of something called venous reflux. A healthy valve within the vein prevents blood from pooling or flowing backward into the vein when it closes. But an unhealthy valve can allow blood to flow the wrong way, toward the foot, which causes the vein to fill with blood and bulge outward. When the valves fail to operate properly, blood flows downward toward your foot instead of back to the heart, and then the blood begins to pool within the vein. This causes pressure that builds up and causes the vein, and sometimes other veins that are connected to it, to swell and become varicose or result in other skin conditions. In the past, the only way to treat varicose veins was have them surgically removed. This procedure, called vein stripping, resulted in a good deal of scarring and was often accompanied by a long and painful recovery. However, the search for less invasive techniques to treat varicose veins resulted in the advent of EVLT, a minimally invasive treatment that uses targeted laser energy, delivered by a very thin catheter to seal the vein shut that's the source of the varicose veins and help you look and feel better fast. The advantages of EVLT over surgical treatments are numerous and include a shorter treatment time, only about an hour per visit in most cases. They're performed in a more comfortable and convenient outpatient setting, like Legacy Vein Clinic. It's highly effective. It works about 98% of the time. There's little downtime. You can return to your normal activities within a couple of days, and sometimes right away. There's no anesthesia or hospital stay, very little or no scarring, and the procedure is typically partially or fully covered by your health insurance. Many people ask about the procedure itself. First, you're given a local anesthesia in the general area to be treated. A catheter is inserted into the vein through a needle, so you'll feel a slight prick. The laser is then passed through the catheter to the top of the targeted vein. There's an additional injection of anesthesia along the length of the vein, and then the laser is activated and withdrawn back out of the vein through the needle. This technique effectively closes or seals off the bad vein with reflux, or the backwards flow of blood. Over time, the vein shrinks and is absorbed by your body, effectively disappearing. After the procedure is completed, your leg will be dressed with steri-strips and bandages, and a Class II compression sock is applied to assist with circulation and speed your recovery. If needed, an OTC analgesic, which is a fancy term for over-the-counter pain reliever or other medication, may be prescribed. You may also be given other post-op instructions on the day of your procedure, and we encourage you to follow these instructions for best results. At certain time intervals after your procedure, an ultrasound examination will be performed. This is very similar to the ultrasound test you had with your initial evaluation at Legacy. The purpose of this examination is to confirm that the vein has remained closed and to make sure there are no other problems with your veins. The test can show if you need additional EVLT treatment or another procedure such as ambulatory phlebectomy, which removes varicose veins on the surface of the leg, or sclerotherapy, which treats spider veins. After your treatment, you may experience bruising along the treated leg. Some patients report a tightening sensation along the treated vein or a feeling of tenderness around the area treated. An over-the-counter pain reliever like Tylenol or Motrin is typically all that's needed, but a stronger prescription can be provided if needed. The following are a list of potential side effects associated with the EVLT procedure. Some of these are rare, but you should be aware of them nevertheless. Be sure to report any problems to your doctor and keep your follow-up appointments for ultrasound testing that can reveal a problem if it exists. Here are a number of before and after examples of patients treated with EVLT. As you can see in each of these cases, the unsightly veins are completely gone within just 2 months. Many patients ask about the research that demonstrates both the safety and effectiveness of the Legacy EVLT procedure. There have been many clinical studies completed. In one large study that involved more than 3,000 treated veins, and in which Legacy Vein Clinic participated, more than 97% of the varicose veins remained closed at up to a 28-month follow-up. The most common side effects reported were bruising and mild or moderate tenderness, and most of these disappeared after 2 weeks. No other minor or major complications were reported. We believe the Legacy EVLT treatment is a perfect match for you. If you have any other questions, please feel free to ask us.